Hello and welcome to this short webinar on the role of ultrasonography in cattle production. My name is Ben Sullivan and I'm one of the vets at IMV Imaging here in the UK. Just to give you an overview of what we're going to discuss in this webinar, first of all we'll start with looking at the goals of reproduction management and how we might go about achieving them, and then we'll look at some of the advantages provided by ultrasonography. I'll run through a brief history of ultrasonography on farm practice, then we'll talk about basic scanning techniques before looking at estimation of fetal age and assessment of fetal viability using ultrasound. Finally, we'll wrap up by looking just briefly at equipment requirements for using ultrasound on farm practice. So it's worth bearing in mind that effective management of reproduction on cattle farms has an enormous impact on the farm's economic success. And reproductive success or successful reproduction management depends both on factors that directly relate to reproduction, so that might be factors such as reproduction efficiency and various calving to first service calving conception rates, parameters and so on that we can measure, but also more broadly general factors that might affect the health of the herd. So that might include nutrition, disease, genetics of the herd and so on. Another key concept to consider is that pregnancy rate, which is ultimately what we're interested in or in maximising, is equal to the submission rate multiplied by the conception rate. So the submission rate is a measure of the number of animals which are ready to be bred on a given farm on a given day that are actually submitted for breeding on that day. And the conception rate is the percentage of those animals which are submitted that then conceive and become pregnant. And we obviously need to strive to maximise both. So what are our goals? Well, first of all, just thinking about that formula we were talking about, we want to try to minimise the calving to first service interval. I just need to like to stress at this point, people do measure calving to first service interval as a metric, but it's actually not terribly helpful as a metric. But I'm just using it as a concept here to illustrate the point that what we would need to try to do is to minimise that gap. In the case of cows, it will be from a previous calving to the point when we start to breed that animal again. Obviously, in the case of heifers, then we're really looking at from the moment that they become reproductively active, or we decide that we want to breed them, to when we actually first then look to serve them, inseminate them. We of course have to bear in mind some things that we can't change or wouldn't want to change too much. We have the voluntary waiting period, and that's going to vary from farm to farm, but certainly if we look to reduce that much below 50 days, we're going to see some negative impact on pregnancy rates. And obviously if we leave that too long, then we're just delaying, we're wasting time, and that's going to cost money. We're going to be straying away from the possibility of having a 365-day calving interval. Now it requires the cows to come cycling again for return to cyclicity, and anything that delays that is obviously going to have a negative impact on minimising the calving to first service interval. So that could be anything, for example, that reduces or delays uterine involution. Could be endometritis, for example. Could be trauma at calving, poor body condition score, and we need to look to address those factors. I guess key for what I want to talk about today, though, is we need to identify animals that are in estrus and then serve them, AI them promptly. So this heat detection, estrus detection is key. The upshot of what we're doing here, so in terms of minimising calving to first service interval, then is maximising that submission rate. So where we had our formula earlier on of pregnancy rate is equal to submission rate multiplied by conception rate, then minimising our calving to first service interval is essentially going to end up maximising our submission rate. That's what we're really looking to do. The other thing we want to do then is to maximise the conception rate. And probably the key to that is going to be maintaining a healthy herd. Part of that is ensuring an ideal body condition score at breeding, and that's going to entail ensuring the body condition score doesn't drop off too much in that period immediately after calving. We're also going to want to cull appropriately as required within the herd to eliminate animals with poor conception rates, repeatedly poor conception rates, persistently poor conception rates. We also then need to bear in mind that any animals that are not pregnant, don't conceive to that first service, we want to rebreed those as quickly as possible. And bear in mind that we're only really going to get 2 and possibly 3 opportunities to breed an animal before it becomes impossible to maintain the 365-day calving interval. And key to that is detecting pregnancy as early as possible, so we are then able to make a decision: don't rebreed this animal, maintain the pregnancy, recheck as appropriate, or make a decision: this animal is not pregnant and we need to get on with rebreeding her. So, looking at cattle reproduction management, minimising that calving to first service interval, just want to talk about one aspect of that, and that is estrus detection. And we want to make that estrus detection as accurate as possible. Predominantly that's going to be through human observation. We may include detection aids in that process as well, so tail paint, KMRs and so on. Studies have shown that 5 lots of 30-minute per day observation by a trained, experienced stockman can lead to detection rates of 80 or even 85% or more. The problem with this is it's inordinately time consuming, so the reality is that we tend to use shorter periods of time and then rely on detection aids helping to increase that accuracy to acceptable limits. The alternative, of course, is to use fixed time AI synchronization programs. They have their merits for certain, and a discussion of those is out with the scope of this webinar. But bear in mind that drugs can be expensive, and some studies suggest that conception rates are lower with fixed time AI and synchronization programs. So maximising conception rate can, as I alluded to earlier, can depend on various factors, but herd health status is going to be key. If there's any intercurrent disease, obviously of the reproductive tract, but also GI tract, respiratory tract and so on, endometritis, pneumonia, mastitis, have we got any locomotor apparatus disease? Clearly foot disease is going to be a major concern, but any other locomotor disease, musculoskeletal disease will also be of significance, and they all have the potential to reduce fertility. Nutrition and correspondingly body condition score are key as well. And then we need to consider the breed timing and technique. So again, that pertains back to heat detection that I mentioned a few minutes ago, but also technique in terms of expertise and experience with insemination, hygiene, insemination, semen thawing techniques if using frozen semen and so on. We also need to bear in mind the role that genetics has to play in conception rates. And again, that'll be part of herd management, will be optimising genetics as appropriate. Early rebreeding of the non-pregnant animal is very important, and key to that is early pregnancy detection, and that's clearly where ultrasonography comes in. So if we think about early pregnancy detection, we need some kind of test to detect pregnancy, and an ideal test would have at least some of these features. The more the better, and there may be others that you might want to add to that, you might think worth adding to this list. We'd want the test to have high sensitivity and specificity. We'd want to be able to use it early on, clearly for early pregnancy detection. We would want it to produce an immediately accessible result, partly because of sort of logistics of management, but also because in the spirit of early detection, if you then have to waste time waiting for the results of test that potentially kind of loses on any benefit you might have gained. We'd want it to be as cheap and easy to perform as possible. We want it obviously to be safe in a spirit of do no harm. And ideally we'd love to be able to assess the age, gender and viability of the fetus as well. So in cattle practice we have various methods of pregnancy detection open to us. Generally speaking, these can be broken down into direct methods and indirect methods. Direct methods rely on per rectum examination, and that can either be rectal palpation, manual palpation, or transrectal ultrasonography, which is clearly the focus of today's webinar. And then indirect methods are essentially hormone assays, and they can either be performed on milk samples or blood, and they can either be cow side or laboratory based. Rectal ultrasound is now very widely used in clinical practice the world over for early pregnancy detection. But what are the advantages of ultrasonography over some of those other tests or test techniques available? So with ultrasonography, you're able to get earlier detection of pregnancy compared to manual palpation, and with increased sensitivity and specificity. There used to be some suggestion that ultrasonography was more safe than rectal palpation, but the wealth of information and data now, wealth of evidence, seems to suggest that in fact that's not the case, assuming similarly experienced operators in both cases. You get an ability to assess fetal viability, and we'll talk about that a little bit later on. And you can accurately and reliably identify twin pregnancies, again assuming a certain level of experience and care from the operator. So just an example here, two examples in fact of pregnancies with twins. On the left image we have unilateral twins, so that's two twins together in the same horn. And then on the right we have bilateral twins, so one twin in each horn. And in both cases we're able to simultaneously visualize the twins on the screen, so we can be confident we're not looking at one fetus twice and convincing ourselves it's twins. We're absolutely sure on these images that we are looking at twins, and this is something that you cannot do reliably with any other method. We can accurately age pregnancies as well, especially in the early stages. Now, the data is vague on this, but the general rule of thumb is for aging pregnancies is probably plus or minus 10%. So if we're scanning at 30, 31, 32 days, then we're looking at accuracy of probably plus or minus 3 days, and that's probably a bit ungenerous. We can actually probably get a little bit more accurate than that. Later in pregnancy or later in gestation it can become less accurate, although with ultrasonography there are ways of improving that accuracy later into gestation, but certainly in the early stages we can be really quite precise, and obviously where we're tying in with known insemination dates we can then provide farmers with accurate gestational ages. We're also able to accurately assess ovarian features, in particular cystic structures. Now, via palpation alone, you can certainly identify certain ovarian structures, and included in that is cystic structures. But one of the key steps we need to take with a cystic structure in their management is to decide whether they're whether they're luteal or follicular in nature. And that's not possible reliably with any method except ultrasonography. We might also want to detect uterine pathology, and ultrasonography is very good at that, so in particular endometritis and pyometra. And then we also have the luxury with ultrasound of being able to determine fetal gender. It's a more advanced technique and takes practice, but once you're experienced, the accuracy, the sensitivity and specificity is extremely high. So just a video here, video clip, if I can get this to work. Just assessing an ovarian structure here. So we have one large and several small follicles on an ovary there. And we can then assess that ovary to check that we're happy with what we're looking at, what structures there are, and of course any change, serial change over time. Again, here we're looking at another ovary. This time we have an ovary with a large CL on it. Again, we're able to assess that structure reliably and confidently. We know what we're looking at. Here, these are stills, I'm afraid, rather than cines. But as you can see, we've got two cystic structures, which sort of externally from manual palpation or on manual palpation might feel very similar. But as we can see, they're quite different, and the structure on the left is a luteal cyst, the structure on the right is a follicular cyst, and we can confidently differentiate those using ultrasound when we wouldn't be able to with manual palpation. And then finally, this is a still image again, this time of a pyometra. And again, this is something which we may be able to feel manually via rectal palpation, but we can be more confident of our diagnosis using ultrasound. So let's take a really brief look at the history of reproduction ultrasound, reproductive ultrasound in cattle practice. So it was first used in a research setting in 1980. Seems a very long time ago now. The first study published on or looking at the use of ultrasonography in bovine practice was by a French team a couple of years later in 1982. And by the early 1990s, ultrasonography was making its way out of the research setting and into clinical practice. And another decade on, or less than a decade on, by the late 90s, ultrasonography had become commonplace in bovine practice in both the UK and the US, and of course nowadays it's widespread across the world. As a company, IMV used to trade as BCF Technology, and BCF Technology in 2002 produced the EasyScan 1. So we can see here in this picture. And this is one of the first portable on-farm units that was ruggedized to work reliably on the on-farm environment. If we fast forward to 2018, BCF, now IMV Imaging, released the EasyScan Go, which is a waterproof, wireless, ultralight, portable on-farm scanner which transmits live ultrasound images to a Wi-Fi enabled device such as a tablet or phone. So, to have a look at the technique, this might seem like a boring safety message, but is worth mentioning. Adequate restraint is very important, not only for the safety of the cow, but also for the safety of the veterinarian. And everyone has to manage that situation to their own satisfaction. So just be confident that when you're going to perform rectal palpation on a cow, either for manual palpation or for rectal ultrasound, just be happy that the setup is such that your safety is looked after and the safety of your patients is cared for as well. So here we can see a veterinarian, typical setup for the UK at least, where we have an animal confined within a space, or just a gate up against the wall here, maybe the end of a race or a cattle crush as well, a chute to use the US terminology, and then we just got some kind of mechanism to stop the animal shooting backwards and squashing the technician or the veterinarian, in this case a chain, maybe a bar there, and then you're free to take hold of the animal's tail, obviously wearing adequate personal protective equipment here in the form of waterproof coveralls and gloves, arm length gloves. One of the key things to consider when preparing to perform ultrasound, and in particular with regards considering the animal's welfare, is to not be shy with the lube. These are 500ml bottles which you can get through quite quickly. You can also get lube available in much larger quantities, and I think the message really is just you can't use too much, so make sure you've used plenty, and don't be afraid to grab some more if you're having difficulty introducing the hand into the rectum. You want to make sure you're not having to push too hard, you're comfortable, you're not damaging your shoulder, but also the cow is comfortable and isn't straining and trying to push you back too much, and plenty of lube can be a massive help. Manual removal of feces can be a little bit of a controversial subject. Some veterinarians prefer not to, on the grounds that in the process you may introduce air into the rectum, which can make scanning actually harder than if you have feces there. My personal opinion is that I tended to find that I could get the feces out very easily without introducing too much air, so long as I kept my arm in the rectum to some degree, and I found it hugely improved the quality of the image I achieved. You have to make a personal decision on this, so pick whichever suits you, but at least consider if you're getting interference between the probe surface and the rectum, you're getting poor contact issues and drop out of the ultrasound image, then it may be worth considering manual removal of feces. Once we've done that and we've got our arm in, usually to around about the elbow or just before, depending on the size of the technician or veterinarian, we can then cup the probe in our hand as shown in this picture, and usually gently pinching the probe between the thumb and either third or fourth finger, depending on your preference, with your second or middle finger, so index or middle finger, sitting on top of the probe, and in most cases there will be a ridge or a concavity in the top of the probe that just gives you an indication of which way up the probe is and have you got it in the correct orientation. Opinions also vary on whether you should start at the cervix and then move cranially to the bifurcation and then along each horn, or whether you should start cranially, pick up the horns at the bifurcation and follow the horns, and then examine the uterine body and cervix on the way out. It doesn't really matter so long as you get into a habit of doing one or the other, so that you know that you're doing a full and thorough exam each time. And what we're looking to do is to perform a thorough sweep of the entire length of the tract, from the cervix to the bifurcation, and from bifurcation along each horn to each ovary. As I say, the order in which you do that doesn't really matter. The key is to make sure that you have been thorough in the way you've done it, and that you can be sure when you finish that you have seen the entirety of the reproductive tract, or if you physically cannot, that you make some note that you haven't seen the whole thing. For further information on the basic technique, if you visit our website and then navigate to the bovine reproductive tract section of the IMV Imaging Academy drop-down menu, we've got a fantastic video series that demonstrates and talks through that basic technique. Just a few approximate timings for significant ultrasound stages when you are performing this process in practice then. We will usually be able to detect the embryo or fluid vesicle from about 28 days onwards. There is some variation here. However, detection of fetal heartbeat doesn't occur or cannot occur ultrasonographically reliably until about 32 days. And because of this, and because of the variability or the reduced sensitivity and specificity of detection at 28 days, and because potential variability of exact insemination dates, or conception dates I should say, I would tend to err towards scanning around 32 days onwards. That way you're able to assess the fetal heartbeat reliably when you perform the first examination. And then from 42 days or about 6 weeks onwards, we should be able to detect placentomes ultrasonographically, though you may not be able to feel them manually at that stage. And then the key when you're performing rectal ultrasonography is, once you've performed the exam, make a decision. The decision you make may well be, I don't know or I'm not sure whether this animal is pregnant or not, in which case make a note to recheck her. But that is your decision. It's a positive, firm decision. Obviously, if you're convinced she's not pregnant or she is pregnant, then that's fine. But you need to make one of those three consciously and positively, and make sure you do book her in for a recheck, or the farmer books her in for a recheck if you're unsure. For animals for which you call not pregnant, don't just leave it at that. Obviously, try to find out why. So first of all, check the rest of or check the entirety of the reproductive tract, remembering it's important to check the ovaries. Is this animal actually cycling? And if so, is she cycling normally or is she cycling abnormally? Are there corpora lutea evident, which would be evidence of cyclicity? Are there follicles, again, evidence of cyclicity? Or are there cysts, which may suggest a cause for interruption of the normal cycling pattern? Is there evidence of pathology aside from the cysts I just mentioned? Is there evidence of an endometritis or a pyometra? Sorry to skip on there. Obviously, if any of these things are present, or you have any suspicions that any of these things might be present, then those need to be addressed. Moving now just on to a brief covering of estimating fetal age. So for early pregnancies, the best measurement we can make ultrasonographically is crown rump length. And with modern ultrasound machines, we can measure the crown rump length once we've achieved the ideal view, which is a longitudinal section, so a sagittal plane through the fetus, simply by putting electronic calipers onto the screen, and that will give us an absolute measurement, which we can then look up on a gestational table, and that will give us an idea of the gestational age. Instead of using calipers, there's actually good evidence that just having a grid on the screen, typically every 1 centimetre, though that can be changed on most machines to be either ½ centimetre or 2 centimetres, can act as actually very reliable eyeballing method. And with an experienced operator, there's actually very little difference between accuracy of aging of fetuses using calipers and measuring precisely versus eyeballing with a grid on the screen. And as I mentioned, you can then look up the age, the gestational age, using published tables. And in fact, at IMV we've produced an app, iPhone or Android app, which enables you to enter those measurements, and it will then give you a gestational age. It's also worth noting, though, that whilst for early pregnancies crown rump length is the best measurement, there are other parameters for later gestation. So, for example, orbit diameter, trunk diameter, skull diameter and length, and so on. Here on the left is just a brief example, a little pictorial example of the gestational age tables IMV produce, and on the right is just a screenshot from our free to download app. You can get this either from the Apple App Store or from the Android Google Play Store. As you can see on the right image with the app, you just click the appropriate measurement. So in this still, for example, we've got crown rump length, but you can see with cattle we also have trunk diameter, skull length and orbit diameter, and then there are measurements on there for equine and ovine practitioners as well. In the top left field, you enter the measurement in millimeters that you've either eyeballed or measured using calipers on your screen, and then that gives you a gestational age in days on the right hand box. And just as an example, here we have a still with the orbit visible. You can see the calipers with the red line just measuring orbit diameter, and in fact just to the right of that red line you can perhaps make out an oval shape, which is the lens, corresponds to the lens of the eye. So we can be confident that we're looking at so basically zygomatic arch and lateral wall of the skull there, and then we can see the lens of the eye, so we know we're measuring the globe diameter there between those calipers, and it's not very easily discernible, but in the bottom right corner of that still you can perhaps make out the measurement 11.3 millimeters, and then correspondingly 95 days, and the little logo there just reminds you that you were measuring cattle orbit diameter to ensure that you haven't made selected the wrong measurement there, made a bit of an error. Just briefly going to talk about assessment of fetal viability now, and ultrasonography is really the only method that can reliably assess fetal viability, particularly early on. And predominantly what we're looking for is visualizing a fetal heartbeat. We can also sometimes see fetal movement, in particular when the fetus is a little bit older, and we can also be confident that we are not seeing flocculent material in the anechoic fluid around the fetus. But first and foremost, we're looking at the fetal heartbeat, and hopefully in this cine loop, which is just playing in circles there, looping over and again, you can make out quite clearly that little heartbeat there in this fetus. So we can be confident that that fetus is alive and well when we're scanning. Not everybody necessarily agrees with this statement, but I think generally speaking it would be fair to say that observation of a fetal heartbeat is a must when you say to a farmer that you're going to diagnose that animal as being pregnant. I think to say pregnant without seeing a fetal heartbeat, unless you're much later on in pregnancy and gestation, and you have a calf that's over a pelvic brim and you've got huge cotyledons and so on, that's obviously a different matter. But if you are assessing fetal viability in early pregnancy detection, as is going to be most relevant with ultrasonography, then you really should be considering observation of a fetal heartbeat as mandatory. Just going to round off then with a brief discussion of equipment requirements for rectal ultrasonography. Almost all ultrasound machines at present use a linear transducer capable of operating between 5 and 10 megahertz. Though in the last couple of years we've actually seen more manufacturers producing electronic curvilinear arrays with convex probes operating at slightly lower frequencies, giving slightly greater depth of penetration and a wider field of view, which have particular merit when scanning in later gestation, such as you might do with beef cattle herds. We want the equipment to be rugged. We want it to be either waterproof or at the very least splash proof. We want it to be lightweight so that we can wear it for extended periods of time on farm without becoming uncomfortable, and obviously with good ergonomics. We want it to be able to be cleaned quickly and easily, cleaned and disinfected. I haven't included it on this slide, but it's also worth noting that we also want it to be easy to use in the practical sense of the machine itself, and then also of any viewing device. We want it to have as long a battery life as possible. Obviously the fewer batteries and or the fewer number of times and the length of time we have to charge them for, the better. And we will of course need some kind of viewing device. And modern equipment tends to come with either goggle type devices, and they may be wired, or we now actually produce wireless goggles, or it may be some separate form of screen. That screen might be inbuilt as to part of the scanner unit itself, or that screen might be separate, not wired in, and connect wirelessly to that screen. There are several products available now, which, as you saw earlier with my discussion of the history of ultrasound, have dramatically improved the lot of the farm vet having to carry the equipment around and use it for extended periods of time without getting backache or what have you, and being able to use that equipment for extended periods of time on farm without batteries running out. So that wraps up this webinar. Thank you very much for watching. I hope you've enjoyed it and I hope you found it useful. Please don't hesitate to go to our website. We have loads more free to use educational resources on our website. And if you have any questions, please don't hesitate to get in touch. Just email us and we will do our best to respond to you as quickly as possible. Any suggestions for further webinars will be very gratefully received. We're happy to help and do what we can, and always keen to produce more content. So if you have any ideas, please don't hesitate to get in touch. Take care. Bye bye.